There's an old adage, if you don't have your health, you don't have anything. Helping people do the best they can at older ages is an important goal for us as a society, for physicians, and for health researchers like us. The National Institutes of Health have made it a focus to understand aging and disease.
The University of Chicago is unusual in that it has, as part of the university, a major social research organization, NORC. Most of NORC's work has to do with executing large federal data collection contracts. But it also has a tradition since its founding of collaborating with academic investigators to carry out academic research. And we value this collaboration with NORC as one of the great contributions to NSHAP and indeed to the execution of social science research.
The National Social Life, Health and Aging Project is a study of older adults and healthy aging. NSHAP, as we call it, began in about 2000. This project was designed to understand how the social world affects other kinds of health and how other kinds of health affect the social world. We've discovered findings that were completely unexpected, that have changed the way we think about some relationships, some dimensions of health, and occasionally have changed medical care, medical practice, or policy as a result.
Among our investigators, we have statisticians, we have sociologists, we have physicians, we have psychologists. It brings together different ways of looking at the human condition.
My name is Louise Hockley, and I'm a senior research scientist.
I'm an epidemiologist.
I'm a statistician.
I'm a professor of medicine at the University of Chicago.
I'm particularly interested in women's reproductive health.
I focus on urban sociology.
I'm a professor of otolaryngology, head and neck surgery here at the University of Chicago. Because the sense of smell system is very closely tied to brain function, we thought that as it declined, it may signal problems in our bodies and our health. So we looked in NSHAP to see whether sense of smell at the baseline assessment could predict mortality 5 years later, and indeed it did. Strongly predicted mortality, much stronger than major diseases like heart disease and cancer and COPD, which we know are really big predictors of mortality.
I'm Kate Cagney in the Department of Sociology at the University of Chicago, and the focus of my research is urban sociology, specifically neighborhood social context and its implications for older adult health and well-being. What we were able to do is to find some external data, particularly on the foreclosure crisis, and look at what difference it made that people lived through that period of time. And one of the things we were able to identify is that when people lived in neighborhoods with high rates of foreclosure, they developed depressive symptomatology over that interval. So it's important to note that these are not people who said that they felt depressed in wave one of our data. They really developed depression over the period. And it's not that they experienced their own foreclosure, they were surrounded by a social and physical circumstance where, neighborhoods became depopulated and resources became scarcer.
Because of my exposure to NSHAP, I pay more attention to how individual patients' social lives affect their health. You see that the isolated older person doesn't do as well. And you see families that are rich in social network that are able to keep someone healthy who otherwise wouldn't be healthy. As a doctor, you actually see the role of the social world on people's health, and it's quite gratifying. And so you see it in clinical practice, and then you go back to NSHAP and you say, can we find other connections between the social world and people's health?
One of the special focuses of NSHAP is on sexuality, on sexual behavior, sexual attitudes, sexual practices, satisfaction, and we've really been the leader in understanding sexuality and its implications at older ages.
One of the most important things about NSHAP is that we go to people across the whole country, all regions of the country, all socioeconomic classes, all races and ethnicities, and that we select the sample in a scientific way means that we, when we get our results from NSHAP, can generalize these to the whole population.
We distribute our data through the National Archive for Computerized Data on Aging at the University of Michigan. NSHAP was also one of the very first studies to participate in NACDA's new data portal project, and you can query and do basic analyses with the NSHAP data set right online, together with a number of helpful materials.
I think if any of us could pick one thing we wanted as we get older, we'd pick good health. Helping people achieve that goal, helping our society do everything it can to improve the health of older adults is good for us as individuals, it's good for families, and it's good for the society as a whole.